Good morning, everyone. Welcome back to my channel. Today, we will talk about ward round participation. We all must have heard about the term ward round whenever we are or someone from our surroundings is admitted to a hospital. So, what is ward round? A ward round is a visit made by a medical practitioner alone or with a team of health professionals and medical students to hospital in patients at their bedside to review and follow up the process in their health. Usually, at least one ward round is conducted every day to review the process of each patient, but it's not necessary that only one ward round can be happen in a day. It can be happen more than one also. In certain practices set, settings such as psychiatric, the ward round may be conducted away from the patient's side. So basically what we are talking here, we are talking about that in the earlier slide we talked about that ward round can be happen in the bedside of a patient, but there are some cases like in case of psychiatric, the ward round is conducted away from the bedside of a particular patient where the team meets elsewhere to review each case. Now, we will talk about goals and objectives for clinical pharmacists on ward rounds. As an important member of the healthcare team, pharmacists should attend ward rounds and clinical meetings whenever possible. This enables pharmacists to contribute prospectively to patient care through the provision of drug therapy. The goals of the pharmacist participation in ward rounds are to gain an improved understanding of patients' clinical status and progress, current planned investigations and therapeutic goals, provide relevant information on various aspects of the patient's drug therapy, such as pharmacology, pharmacokinetics, drug availability, cost, drug interactions, and adverse reactions. Also, optimize therapeutic management by influencing drug therapy selection, implementation, monitoring, and follow up. Investigate unusual drug orders or doses. Assimilate additional information about the patient, such as comorbidities, medication compliances, or alternative medicine use that might be relevant to their management. Detect adverse drug reactions and drug interactions. Participate in patient discharge planning. Ward-round participation also provides many learning opportunity for the pharmacist. It allows pharmacists to see first how drugs are used and prescribed and see the effects of these drugs on patients. With time, pharmacists develop an appreciation of how the patient's own wishes and their social, cultural, economic circumstances may influence therapeutic choices. Even for experienced clinical pharmacists in teaching hospitals, it is very rare to finish a ward round without gaining new perspective on some aspects of therapeutic or patient care. For those involved in academia and research, ward round allows identification of cases for clinical teaching and publication. Not the least, ward round participation strengthen the interprofessional relationship among various health professionals, leading to better healthcare practice and research. So basically, ward round is important for a pharmacist. Either he's working in academics or either involved in the research. Either he is fresher or he is experienced. So basically ward round is giving new information for the pharmacist as well as for the doctors as well. So basically we were talking about pharmacist here. All these are the goals and objectives of the clinical pharmacist that are involved in ward round participation. Hope you understood about today's